So, hi everyone. I'm Rita. I'm a GP and Career Director of British Society of Lifestyle Medicine and a culinary coach. I have become aware of experiences of a number of people living with bone and joint pain, especially during the pandemic when operations have been postponed or joint injections are being offered with extreme caution. I chose to discuss about bone and joint pain today as I felt we could try and help develop skills to maximize quality of life and reduce disability without resorting to surgical options. In essence, do not allow the pain to control your life. It's my pleasure to have Dr. George Ampert here with me today. George is an orthopedic consultant who recommends lifestyle changes as the first modality of treatment for bone and joint pain. So welcome, George, and I'll have to just move it.
Thank you.
So welcome, George, and please tell us more about what you do.
Thank you, Rita. Thank you for inviting me to this program. I'm an orthopedic consultant, and for many years, I was doing routine operations for hip and knee pain, for back pain, and but after the last few years, I've taken the decision not to operate any further and to try to treat people without surgical intervention. I'm not saying operations are not necessary, but maybe sometimes people are not, exploiting all the possibilities of non-operative intervention. So that is what I'm focusing more, helping people to maximize the non-operative methods of treatment. Operations are good, but sometimes operations causes complications and you may not have the desired effect. So that is why, I'm trying to help people without surgical intervention if possible. And that is my main focus. So thank you. Yeah.
I know you are quite passionate about advising people about lifestyle medicine and its role in chronic pain. And we have met at few conferences and I have heard your talks on this topic before. So can we begin by asking a basic question? What is pain and what is happening in our body when we experience pain?
It's a very good question. Pain is like an alarm system. Pain is nothing more than a fire alarm in your house. Because what is a fire alarm? It tells us that there is danger, there is a fire somewhere, and then we have to escape or put out the fire. So it gives us the advance warning. So similarly, pain is actually not a pain. It is a blessing, because if you didn't have pain, you wouldn't have sensation and you could actually cause more damage. Yes, when the pain becomes severe, it is very unpleasant. So pain, when you describe it, it is an unpleasant feeling. It can both be a physical feeling as well as a psychological and emotional feeling, because the effect of pain is not just physical. As I said, it is psychological and emotional. It can drain you. But on the other hand, pain is important. If we don't have pain, we are likely to injure ourselves and not know that we are injuring. So it is a protective thing. It's like having a fire alarm. A fire alarm protects us. But sometimes the fire alarm can become faulty. That is, it may go off without actually a fire being there. Now, that is when the problem occurs. Chronic pain is like that. When the fire alarm goes off. In the house, when the fire alarm becomes faulty, it is easy to go to B&Q and buy another fire alarm for 10 pounds. But inside the body, you can't change the nerves. So that is when it becomes difficult on handling chronic pain. But now research has progressed that we can handle chronic pain by different modalities. Hope that I have given some understanding of that. Yeah.
So does that mean, George, that our nerves are misfiring and our brain is not processing it in the way it should?
Yes.
So
it is to a certain extent. Yes. So one, it can be that there is an insult, like there is an injury or there is inflammation, and that is why we are recognizing pain. But sometimes in chronic pain conditions, it is possible that there is no actual injury, there is no actual inflammation. It is just the nerves are misfiring and there is a wind-up mechanism which tells the brain there could be a problem when actually there may not be a problem. And in that situation, it is important not to seek other methods of treatment, because that will be like trying to have an operation, and actually the operation may not make any difference. Because in many conditions, many situations, we may find natural problems which may occur, natural degeneration. Like for instance, in the neck or in the lower back, we may find degeneration. These may be natural changes which are there. Yes, we may then wrongly suppose that those natural changes are the cause of the pain, and then we may do an operation. But actually, the fire alarm is still faulty, and you have done a needless intervention, and it may increase the pain. So we have to be very careful before we are subjecting any patients to any surgical intervention in those cases.
Right. Thanks for that, George. So how can one find relief from pain without taking tablets?
Well, the easiest is exercise. And, people get very worried about how exercise will actually, give pain relief. Let me give an example. So hopefully we can understand, our patients can understand this better. So I'll take the opportunity to share my screen, if that is okay, Rita.
Yes, absolutely.
I've got a short presentation. Sorry, give me 1 minute. So this is like a normal car. Hope you can see that, Rita.
Yes, we can.
So this is like the normal car with a tire and a shock absorber. Now, in normal cars, we have to inflate the car tire. So say, for instance, in this car tire, we have to inflate to 40 PSI. PSI is pounds per square inch. Now, when the tire is well inflated, the tire is plump and it is firm, and then the car drives very well. When the tires are plump and firm, and if you drive the car, there is no wobbliness and the car drives well. But unfortunately, and there is no damage to the shock absorbers remain well. But unfortunately, if the tires are not fully inflated and only half inflated, say the tires are only pumped up to 20 pounds per square inch, if the tires become underinflated, then it is likely that there will be wobbliness as the car moves forward. And if you keep on driving on this underinflated tire, then there is an increase, because of the increased wobbliness, there is an increased strain on the shock absorber, and it's likely the shock absorber will be damaged. That is exactly what happens in the human body. So let me explain what happens inside the human body. Let's take the lower back for an example for now. So this is just a schematic diagram. You can see the outline of the body. These are the thigh bones, and you can see there are the ball and socket joints. This is the pelvis here. And above the pelvis, you can see the vertebral column. The vertebral column of the spine consists of blocks of bones like this. And in between the blocks of bones, there are cushions. And on either side, there are muscles. Now, we are only able to stand up, not because of the bones and joints, but only because of the muscles. The muscles hold the bones and joints in place. And because the muscles are holding the bone and joint in place, we are able to stand erect. See, if we were to take away all the muscles, we'd just be a sack of skin with bones. So it is the muscles that are important. In this situation, the muscles are strong. And because the muscles are strong, there is less stress on the discs. But on the other hand, so just like the car tire, which is well inflated, there is less stress on the shock absorber. But on the other hand, if the muscles are weak like this, then it is not going to support the spine. There is more wobbliness. And actually, in this case, the increased wobbliness has damaged these two discs. The disc should be sort of green and good in color, but you can see there is pain in both these discs because of the increased wobbliness. So it is important to build these. But unfortunately, when we have pain, our immediate reaction is not to move that body part. But when you don't move that body part, the muscles become weak. When the muscle becomes weak, it increases the pain. So it becomes a vicious cycle. We now need to convert that vicious cycle into a victorious cycle. Though you have pain, you need to build up the muscle. And when you build up the muscle, it supports the spine and the skeleton better. When it supports the spine and the skeleton better, it decreases the pain. So then you're converting the vicious cycle into a victorious cycle. So that is what we need to do. And that is how exercise helps. Hope that example was clear, Rita.
Yeah, that was really a good example of how exercise can help. Um, but is there something called a pain barrier? And should we be fighting our pain barrier, George?
Very, very, very valid question, because what patients want is they want to do things so quickly. Once you tell them exercise helps, some of them are so keen to do the exercise and do too much too soon.
Yeah.
And actually that may cause more problems. And let me explain by another metaphor, because everyone wants to be better. No one wants to suffer in pain. So as soon as you give them a solution, they want to, grab on that solution and work harder. But doing too much too soon is bad. And let me share the same screen, and I will explain that with another example. So look at this. This is just an example of Patricia. She was a businesswoman, executive. She had to drive from Liverpool to Manchester. She was late for the meeting, and so she decided to speed over the speed limit. And so she was breaking the speed barrier so that she could reach Manchester quickly. But unknown to her, the police were watching, and the police found her, caught up with her, and fined her. She had to wait for about 1 hour with the police. She also got a fine. She was late for the meeting and could not go reach Manchester in adequate time. And that is exactly what happens. Here, Patricia went over the speed barrier. Yes, when we exercise, when we experience pain, we should stop. We should not go over the pain barrier, because if you go over the pain barrier, there is a policeman inside us. The policeman inside us is the inner brain. So if we do too much too soon, the inner brain is going to send the pain signals down, and actually you will feel your purpose has been defeated. Just like how Patricia found that she could not reach in time and actually was more delayed. So it is important that we are not doing too much, and we should not fight the pain barrier. So what I tell my patients is you should recognize and stop before the pain barrier. Just like how when we drive, we look at the speedometer. If it is a 40-mile limit, then we should always keep it around 35. You should not go at 40 or 45, because then you're likely to be always slightly less than the speed limit. And that is similar, same understanding that you have when you drive a car, you need to have when you are experiencing pain. Say, for instance, if you walk 10 minutes, you will experience pain. Then you should not walk 12 minutes. You should walk 9 minutes and you should stop. And when you stop, the pain will get better. So which means that at 10 minutes is a red light. At 9 minutes is amber. You have to stop at the amber. Don't go through, wait till the red light is on and go through it. So stop at amber at 9. Allow the pain to settle. All lights will one day change to green. So when it becomes green again, then you start your journey again. You have to split it. And once you do that, then you're okay. But on the other hand, if you go beyond that 10 limit or the pain barrier, then suddenly your brain gets stimulated because it is a protective reflex. It showers pain because it doesn't want any harm. And then you are in much more severe pain than what you started with. So then the whole purpose is defeated. So it is important that we are not fighting the pain barrier, Rita. Yeah.
Thanks for that, George. I know the example you gave about the traffic light system is brilliant. Who decides where is it you, or your body tells you, or should be a professional deciding how much you should be doing?
It is you yourself, because the person who has got the pain only knows, because what one man's pain may be different to another person's pain. Just like, I'm not making, they talk of, say, for instance, delivery. Women are very strong biologically. They can withstand the pain of labor, but men may not be able to withstand. So we have biological differences. So same way, even among individuals, there are biological differences. Some may be able to tolerate the pain better, some may not. So these are all individual variations. Yeah. So
yeah, I think it's probably more relevant, especially in the pandemic, where I'm thinking people are on their own at home. They're getting appointments with physiotherapists, maybe phone calls, maybe video calls, but not as promptly as they would expect or they would want to be. So they can do it themselves at home, understanding and knowing this, the limitations. So that's really good to know. Thank you. So we were also talking about back pain, and we do think lifting brings on back pain. Now, is that true?
Well, it is to a certain extent true, but it is not just a straightforward answer. Lifting causes back pain, and let me explain that. Sorry, I'm giving you a lot of metaphors, but hope it helps our patients to understand.
It does. It does.
Okay. So let me share my screen again, Rita. So let's take this example of Peter and Paul. Peter and Paul are twins. They are identical twins, which means they were born from the same egg. In other words, their genetic material is the same. There is no difference between Peter and Paul. So yes, any difference is not genetic by any chance. So now they have different jobs. Peter works in a removals company and Paul works in a bank. Peter is lifting every day. So for 8 hours every day, he's taking boxes from the house to the van and then from the van to the house. So every day he's lifting something like 3 tons, not in one go, but in small, small boxes. But because he's so physically active, his back, his muscles are very strong. But on the other hand, Paul, his twin brother, works in a bank. From morning to evening, he sat on a desk and the only physical activity is pushing some keys on a keyboard and pushing the pen on paper. There is no other physical activity. So one is fit and exercising every day, whereas the other person is not fit, but their genetic material is the same. Now, over the weekend, both of them have to do some gardening in their own homes. Let's consider. So what happens is Peter has to lift a couple of pots of plants and he's lifting with no problem. But on the other hand, Paul, the bank manager, he lifts 2 pots. And unfortunately, when he was lifting those pots, it caused pain and he is in severe pain. He is blaming the lifting as the cause of his pain. But what we need to understand, is lifting the cause of pain or was he fit to lift? If he was fit to lift, then he might not have experienced it. Now, it is like this. We have 100 soldiers who are going to war. 50 are fit, 50 are not fit. Who's going to survive in the battlefield? Yes, it is quite likely the fit soldiers are going to survive in the battlefield. Similarly, if you're going to do some gardening, who's going to survive the gardening? You need to have some fitness even to do gardening. You cannot be sitting in an office for 5 days a week and having poor muscle and tone and control, and then decide that you want to go and do the gardening. Then if you lift the pots, you're going to hurt yourself. So yes, lifting will cause back pain, but if your muscles are strong, then you will not be causing the back pain. You will be able to control the deleterious effects of lifting. Yeah.
That's wonderful, George. That was really great. So today we learned a little bit about what is chronic pain, what's the loop of chronic pain, how it affects us, and how we can take control of the pain and how we can manage it ourselves. So today, if we can have some exercises for, say, neck pain to start with, can you demonstrate some, or would you be able to share some exercises with us?
Sure. I will first show the exercises and then I will explain those exercises, by myself. So let me share my screen again, Rita. So now we must understand there are 6 movements in the neck. So one is looking down, the other one is looking up, the other one is tilting to the right, the other one is tilting to the left, the 5th one is turning to the right, and the 6th one is turning to the left. So there are 6 movements for the neck. But the important thing there is that it is not trying to move the neck that is important. Many people advise patients to turn their neck and to move their neck into painful positions. But I personally find if you actually move the neck into painful situations, you're going to increase the pain. So I don't recommend range of movement exercises. I recommend strengthening exercises. And let me explain what strengthening exercises are. So now let's look. So there are 3 groups: looking up and down one group, tilting left and right one group, and turning to the right and left one group. So let's look at looking up and down. So here is how you're doing the exercises, looking up and looking down. And let me explain it. So let me explain with my own. So For instance, you want to now strengthen the muscles in the front of the neck. So you can either hold on the head here, or you can hold underneath your chin, and you hold it underneath here and you're pushing down with your head, but this hand prevents your neck from coming down. So it is only a resistance. So the hand is providing the resistance for that movement. So initially you don't want to do the 100% resistance. You want to start only with the 25%. So you're resisting and you want to count for a count of 10. So I'm pushing down into my hand. My hand is preventing the movement of the neck, and I'm doing 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That is the looking down. Same way, the looking up. The muscles at the back of the neck need to be exercised. So you can cross your hands, intertwine your fingers, and keep it behind your head. Your head is pushing into your hand, and your hand is preventing the head from going back. So again, I don't want you to put full force on it, only about 25% to start with. Slowly over the weeks, you can increase the resistance. So now my head is pushing back into my hand, and my hands are pushing the head forward or resisting that movement. And I'm counting 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. When we do that, when we count from 0 to 10 or 1 to 10, it is 7 seconds. And 7 seconds is enough to increase the strength of the muscle. So the first two exercises were pulling down and lifting up. The next two, let me share again. Is now tilting to the right and tilting to the left. So how do you do that? So you keep your hand above your ear like this, and you're tilting your head down this way, and your hand is preventing that. So again, we'll do that. So I'm pushing my head into my hand, and my hand is preventing the movement. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. So that's tilting to the left. Now tilting to the right, you put your hand on here, and your head is tilting that way. Your hand is preventing that. So again, a count of 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So that is the side tilting movement. So we are now done 4 movements. So there are 2 more remaining, and I will share my screen again and show the last 2. So now it's turning to the right and turning to the left. The hand in this diagram is not positioned very well, but I will show it on my, on my own body. So you keep it on your chin here. The first one was keeping it on the head, but now you keep it on your chin, and I'm turning to the right, and my hand is preventing the turning to the right. So same way, my head is turning, my hand is preventing. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then on the opposite side, you hold your hand on the chin on the opposite side. You're trying to turn that way. Your hand is preventing that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So there were those 6 exercises. So let us revise them quickly. One is to keep your head at the back. You're pushing backwards, your hand preventing. Exercise 1. Then you cup your hands, you push down, and the hand preventing. Exercise number 2. Then you're tilting your head, your hand is preventing. Exercise number 3. Tilting your head the opposite side, the hand preventing. Exercise number 4. So you don't need to do any movements, you're just the resistance. 5th exercise, you're turning your head, your hand is preventing. Exercise number 5, and then turning to the opposite direction and the hand preventing. Once the strength of the muscle comes back, the range of motion will automatically come back. But on the other hand, you ask the patients to increase the range of motion on day 1, they are going to have increased pain, and then there's going to be non-compliance because they are not going to do it. Whereas if you actually get them to do this, slowly increase the strength of the muscle, over time, they will recognize that they are moving their neck very well. So this is the main exercises for the neck. So that the simple exercises which we can teach over a consultation, maybe 5 minutes. I will also send you a written sheet with all these exercises.
Yeah, that will be wonderful.
For patients. Yeah.
No, that's really, really good, because I think with we all working from home a lot more and children doing homeschooling, being in front of their computers and phones a lot. I think neck pains, we are experiencing in general practice a lot of people with neck pains, and these exercises I think will be much appreciated by everyone. And I think two things are really good that I learned today was about, like you mentioned about your own resistance, using your own resistance, and you don't need any equipment, and not to fight the pain barrier.
Thank you. Thank you.
Especially.
Thank you, Rita.
So that's really good. Thank you so much, George. And this is one of the 4 series, we must say, or one of the 4 podcast, interview, whatever we like to call it. And we'll see you again next